Hello, I'm Dr. Ron Vargo. I'm a chiropractor in Canton, Ohio. Welcome to my third video in the series Opioids 101. On my first video, we talked about opioids, what they are, how they affect your brain, how they affect your body. On the second video, we talked about how they were abused. And on the third video, we're going to talk about what the answer is. How can we stop this crisis? Because it truly is a crisis. Thousands of people are dying every year, and for some reason, Ohio is ground zero. There's more people dying in Ohio than any other state. So how do we solve the problem? Well, we've got a two-prong approach. We have to look at it two different ways. Number one, there's a group of people that are already addicted, already hooked. They're already in trouble. Obviously, those people have to go to rehab centers, counseling, drug addiction centers. The problem is it doesn't always work. It's not a surefire bet. Some people aren't going to make it. So we have to look at the other approach too. Why not stop it before it happens? Why not go to the source? If someone's having a pain, why not give them an alternative way to treat it before the medications? Does that make sense to you? The problem is that's where the abuse came from. For the last 20 plus years, people have been giving the drugs first, the meds first, and the conservative care second. It should be reversed. The conservative approach should be done first, right? Drugs second. Now, I'm a chiropractor. As a chiropractor, I treat soft tissue injuries. I do it without drugs. It would be tooting my own horn. It would be biased of me to say that come to a chiropractor. Let chiropractor be that first avenue for pain. So I'm not going to do that. I'm not going to tell you that. I'm going to let other people tell you that. Other people that are highly respected sources. Let's go to our governor, okay? Governor Kasich. He put together a task force. His state's the #1 state dying of opioid abuse. So he put together a group of people, doctors, okay, among others, to determine what is the alternative way to take, what can be done. That panel came back and said conservative care should be done first, and in that conservative care, they mentioned chiropractic. So Governor Kasich, okay, his panel has recommended chiropractic to be tried first. Let's go to a group of MDs called the American College of Physicians, or ACP. They came up with very similar results. A conservative approach should be done first, and within that conservative care, chiropractic should be tried. Boy, there's something, a group of doctors, a group of MDs recommending chiropractic. Boy, have times changed. Let's go for the Cleveland Clinic. The Cleveland Clinic is known throughout the nation and the world as a top-notch medical facility, right? They're telling their doctors before they do any type of medications to treat low back pain, conservative care should be done first, including, as an option, spinal manipulation. Now, who does spinal manipulation? Now, they say to try that for 4 weeks. Then, if that doesn't work, they say to reassess. They say to look for red flags, and if none are found, try it again, another 4 weeks before drugs are being used. Now, finally, let's go clear to the top. Let's go to the White House. They just recently published a paper, their answer to the opioid crisis. They, word for word, say that if chiropractic is tried, opioid use will decrease. Chiropractic reduces opioid use. So I don't have to toot my own horn. It's already out there. Other people are tooting it for me. So let's talk about chiropractic. What is chiropractic? I'm sure a lot of you watching this video do not know what a chiropractor does or what a chiropractic is. So let's start with that. As a chiropractor, I'm considered a primary healthcare physician. That's pretty powerful. That means I will write a diagnosis out. I will tell you what is wrong, and it's up to me. I'm responsible to tell you a mode of care, whether I can help you or not. I have to know where to send you if I can't help you. Now, to do all that, it starts with an examination, and it's a very, very thorough examination. It takes generally 20 minutes to 45 minutes minimal, and it's going to include things like range of motion that are measured for the body part injured. It's going to include things like neurological testing, reflexes, are going to be measured. Vital signs are going to be taken. Orthopedic tests are going to be given. And if x-rays are needed, we're going to request or take x-rays in our office. Other diagnostic studies that might be needed that it's up to us to decide in order might include things like an MRI, a CT scan, a diagnostic ultrasound, maybe some bone scans, maybe blood work. But we can order that, we can write a script, and that person will then go to any hospital to get that done. Okay? What do we treat? We treat what's called the neuromusculoskeletal system. That is bone, joint, muscle, tendon, ligament. It might be in the spine. It might be a shoulder. It might be a knee, an ankle, a wrist. Virtually any place in the body, that's our specialty. How do we treat it? We treat it obviously with our hands too. I mean, that's how a spinal manipulation is most generally given. There are some instruments that also can do that. But some other types of treatment in our office, some other tools might include muscle stimulation, might include heat or ice, might include therapeutic ultrasound, that's sound waves, might include laser, cold laser. It might include things like bracing, like kinesiotape, a TENS unit. All these are just some of the tools that a chiropractor can use. Maybe traction. Basically, we can do just about anything except prescribe drugs, give shots, or give medications. So our goal is to make sure that a person will function as proper as can be, as good as can be. Because if that neuromusculoskeletal system isn't working properly, there's going to be a problem, generally giving you pain finally at the very end. Pain is a warning sign telling your body there's a problem. My job is to make sure it all works together like it should. And then ideally the pain will go away. If it doesn't go away, or if I don't feel that I can help you, then I'm going to know who to send you to or what other tests to order. Okay? So I guess my main goal and my main message on this video is to stop it at the source, to try conservative care first, medication second. So I ask you, if you know anybody, any family member, anybody at all, loved one, neighbor, that is going through a problem, a physical type of pain, and they are either on drugs or they're thinking about taking medications, just ask them, have you tried chiropractic first? Have you tried a conservative source first before taking the pills? You know, the CDC says only one prescription is enough to make you addicted to opioids. See what they say. Tell them a chiropractor is a primary healthcare physician. That chiropractor is trained to find and know if he or she can help you or not. If everybody did that, I feel that that would make a huge difference. If you would like to learn more about opioids, visit my website, www.vargochiropractic.com, and there is a large section devoted just for opioids. You will learn a lot. Thank you very much for listening to this video and giving me your 7 minutes and 45 seconds of time. I hope this helps you. I hope this helps make a difference.